The Eastern Cape has faced significant challenges around teenage pregnancies. This is contributing to an increased incidence of HIV among young women. HIV testing has now been ramped up in the province. And Eastern Cape Health MEC Ntandokazi Capa says the province's teen pregnancy rate is much too high.
Last year, as the province, we tested about 46,000 people and we did put them on treatment. And from January up to now, we have about 22,400 people that are HIV positive, but they are also on treatment. But as the province, we can say one thing that we're battling with is the 10 to 14 of girls. But the funny part is it's only the girls, but the 10 to 14 boys are not really rising in terms of numbers. And again, we generally have men that are not willing to test. So those are the two things that we're grappling with as a province.
People who are aged between 10 and 14 are children, by any definition. Do we know where they get these infections? Are they born with the virus? Are they infected by adults? Do we have any idea?
I do not have a scientific explanation to that, but what we know, we are having a challenge of high teenage pregnancy rate in the province. That is why you will have then the 10 to 14 girls being infected, and yet the boys 10 to 14 are not really on the rise. So we need to do a thorough research in terms of that, because indeed they are children. When you talk about 10 to 14, those are the children. But what we want to say is we suspect that it's not the boys that are pregnanting these girls, are the older men, because you do not have a level in terms of infections between the girls 10 to 14 and the boys 10 and 14. So it actually means there's something that we need to look further into as the department.